Welcome to Bike Fitting 101. Today we are going through the basic process of how we incorporate a bike fitting right here at EverStrong Therapy. My name is Amar Parak. I am a certified professional bike fitter as well as a physical therapist. My perfect patient today is Elijah, owner of Evergreen Strength and coach, who also happens to understand a lot about bikes, rides bikes every day. And so we're gonna go through the basic process of how we fit bikes, what we look for when we are fitting bikes, and kind of go through the whole process and show you what's up. So let's talk about some of the stuff that we need going into a bike fit and the stuff that we use here at EverStrong. A lot of bikes, especially mountain bikes or bikes with fatter tires, don't really work with rear mounted bike trainers. And so having a front mounted trainer allows us the versatility and the flexibility to work on all types of bikes. Second thing we need is a laser level. This is gonna allow us to make sure that when we get the bike on the trainer, everything is level. Obviously we have our wrenches and our Allen keys to fit all types of bikes, goniometers and stickers, picks to get dust off of cleats or clips, especially when we're dealing with fitting pedal position, plumb bobs and levels and clipboards and general tools in order to make the adjustments we need on the bike. So the first thing I'm gonna ask Elijah is usually for a subjective report. Hey, do you have knee pain? Do you have back pain?
Not really, I feel pretty good.
Great. 84% of cyclists will have some form of pain in their cycling lifetime. When we first do an assessment, the first thing I need to look for is anatomical landmarks, because we're gonna talk about his cleat position and his pedal position first. So I'm gonna ask him just to stand comfortably while I grab my stickers here. So first thing I'm looking for is his big toe, and we're gonna find his first met head through the nobles. And then I'm making a line pretty much straight across, and then I'm measuring his fifth met head as we come on back. Finding landmarks tends to be one of those things you develop a feel for. And these are really important when it comes to identifying the most optimal foot position that we have. Second, I'm gonna find his big toe, his second toe, second met head, and I'm gonna come straight across. We're gonna measure here. I'm gonna do the same thing with his second foot, because these landmarks become critical when it comes to getting the right fit. All right, Elijah. We have our landmarks, and now we're gonna have Elijah ride a little bit just to get an assessment of kind of what he feels and how it looks. So we're gonna chat here for a little bit. I'm gonna take a quick peek. I'm looking at his hips, his knees. I'm getting a sense of kind of where his pedals are looking. So Elijah's been riding for a little while. Now it's time to make some adjustments. The first thing I want to adjust is make sure that he understands where his foot position needs to be on the pedal, because that's going to set the stage all the way up the line. We're always looking at that fifth met head, or where this back sticker is, and I want his pressure to be going just in front of that fifth met head. When you're making assessments, it can be anywhere between the first and fifth. However, if we're trying to generate power through the piston of our legs, being further back, closer to that fifth met head is going to be most optimal. So I'm actually going to scooch him back right there. And then we're going to do the same thing on this side. So again, I'm looking for where his spindle is. I'm drawing a line right across, and then we're going to put his fifth met head, or that sticker, right there. Right now, I'm just going to have him ride to see how he feels, and if he feels a difference in power being able to generate right down the line. The next thing I want to check is his knee angle when his pedal is furthest down away from him. So before I even get into that, I'm gonna have him pedal a little bit, and I'm gonna put my hands on his feet. This is gonna be really important so I can see what his heel is doing as he's pedaling. 1, 2, 3. So this allows me to assess his heel position in comfort, see what he does when he stops, and now I can measure this angle right here. Our standards are 25 to 35 degrees of knee flexion. More optimally, I want him to be in 25 degrees because it allows more extension through the knee and allows him to generate more power. So what I'm gonna do is I'm gonna take a quick measurement here. Landmarks for this: greater trochanter, lateral malleolus, and mid-knee. So the goniometer is gonna go right to your mid-knee. I'm gonna palpate here. So Elijah's sitting at about 22 degrees, and how this might showcase for a patient is if you come around back this way, you can see his hips are shifting back and forth. So when we get to very low angles, he might be compensating because his saddle's almost too high, causing him to shift his hips from side to side. I want to drop his saddle down just a hair so that we can minimize this bit of movement right here. We've adjusted his saddle height. First thing I want to look at is back here to see how this is moving. Second thing I'm going to do is I'm going to measure his knee angle again. So we're gonna do the same thing, 3 rounds. 1, 2, 3. So we've increased him from 22 to 26 degrees. So if we're right, what we might see is a minimization of his lumbar movement here, and he might actually feel a little bit more power or more stable through his midline. So now that we've measured the height of the saddle, the next thing we need to measure is the saddle with regards to your fore-aft position. Now in reality, we could look at his torso angle, his shoulder, and all of it plays a part, but the way we measure it is actually using this knee angle when the crank is at 90 degrees or pointing right at you. So we're gonna do the same exact thing where we're gonna ride. However, this time, I'm gonna have you stop right where you are now. 1, 2, 3. Now for this, we have a very advanced tool called the plumb bob. And what I'm gonna do with this is I'm just gonna take this and I'm gonna measure right off his mid-knee as we come down. When I look at Elijah here and where the pedal spindle is, and I draw a line, he's pretty much right on the line with regards to his knee position. Now this is great, especially if Elijah ever had knee pain. This is kind of a good position because it minimizes knee strain. If he wanted to be more aggressive on his bike, or if he wanted to put a little bit more power through the bike, I could move his saddle forward in order to then put his knee in a more anterior position, allowing him to have a little more knee drive. However, if you do have patients with knee pain, or if you do have somebody that has knee symptoms, it's more important that they're sitting back and minimizing the amount of stress through their knee joint. So when we're talking about the saddle, the last thing we want to change is the tilt position. So there are standards to this. 0.5 to 2 degrees is the standard that we use. Elijah doesn't have pain, so our goal isn't necessarily to reduce his pain or symptomatology, but more to improve his comfort and efficiency when he's riding. We have 2 main tools in order to measure saddle tilt. One is super expensive. It's called the clipboard that we're gonna put right on top in order to get a flat surface. And the second thing that we use is the digital level. Optimal tilt is 0.5 to 2 degrees. However, as far forward as he can manage without feeling like he's sliding off of the bike is kind of where we want to be, right? So I'm going to put this here. So Elijah's right at 0.8, which is right within the line of 0.5 to 2 degrees. If he was comfortable, I would probably adjust him a little bit more into a tilt position because it allows us again to be a little bit more efficient. Now there's a couple things to note here. I'm gonna spend a lot of time asking questions to my client, or to Elijah in this case, about low back pain and more specifically perineum numbness or pain, because those are the things that are gonna affect our tilt position, and those are the subjective reports that we're gonna use to identify the optimal tilt for him. I'm trying to be a little bit more aggressive with Elijah because like I said, he doesn't have symptoms. So when we look at that 0.5 to 2, he is right at 1.9. I'm gonna have Elijah jump on this bike, ride it, see how he feels, give him a few minutes to kind of test it, get a sense of where the saddle feels and how the saddle feels after we made most of our adjustments. So most people that are tilted too far might experience some perineum numbness. So I would tell Elijah, be on the lookout for some symptoms like that. You should feel a little freer in your hips, and therefore, if you did have back pain, especially after long rides, that should go down. Because while I might only have Elijah for 90 minutes for a bike fitting session, he's gonna ride this for hours and hours and hours. So knowing and understanding the clinical significance of what we've done is really important when we do a bike fit. So now that we've got the saddle dialed, we've got the pedals dialed, we've got everything, now it's time to look up the body. Now, I normally look at shoulders and I look at low back as far as his amount of lumbar flexion and his shoulder position. If we were to make changes to this and we know that his saddle and his pedals are appropriate, that's when we go to the handlebars. But that's a whole different discussion. It's a whole second piece, which we'll get to later. For now, I'm gonna have Elijah ride. We're gonna get his thoughts on how he feels both before and after his bike fit, and we'll wrap this thing up.
The changes are super subtle, but like you notice, making little tweaks, how that affects your position and how comfortable you are, and even just like adjusting the seat post a little bit down and pitching me forward a little bit, like, and you start to pedal, you notice like I do have more power in my pedaling. So it was cool to see like how little micro changes, even though I have a pretty good grasp of how I should feel on a bike or what it should look like, making those like micro adjustments, it's cool. It makes a difference for sure. If you ride your bike regularly, you should get fitted correctly because I think it's worth it for sure.
Thanks so much, stay EverStrong, and if you do want your bike fitted, we're kitted out and ready for you. Thanks so much. Peace.